Hi, I'm Dr. Ed Feinberg, and today I'm going to talk about the elephant in the room that's rarely discussed, age discrimination. I've never, nor will I ever think of myself as old. I'm 72 years old. At 72, I am still practicing dentistry. I'm writing my third book, a textbook on full coverage restorative dentistry, and I'm creating courses and blogs like this one for my teaching website, www.theonwardprogram.com. My CV is 20 pages long and growing, and the list of continuing education courses that I have taken since 1989 is 54 pages and growing. Contrary to the stereotype about older individuals, I am extremely adept at using a computer, and I've even taken them apart. Oh, and lest you think I'm physically decrepit, I'm an avid gym rat who can perform bench presses with two 50-pound dumbbells, and my average time for the 800-meter row on the concept rower is 3 minutes and 30 seconds. Recently, I had to experience the unpleasantness of age discrimination, aka ageism. The term ageism was coined in 1969 by Robert Neal Butler, founding director of the National Institute on Aging. Kirsten Weir of the American Psychological Association defines ageism as negative and inaccurate stereotypes that are so ingrained in our culture that we don't even notice. Joanne Montpar, PhD, director of the Rosemary B. Fuss Center for Research on Aging and Intergenerational Studies at LaSalle University, reports that ageism is the last ism that still remains socially acceptable, even though other isms have already gone by the wayside. Ageism is often confused with ableism. While it is true, says Kirsten Weir, that the risk of some chronic diseases and dementia increases with age, most older adults maintain quite good health and cognitive functioning. In fact, Brain Health University maintains that adults in their 40s, 60s, and beyond show increased depth, better long-term memory, and more strategic thinking than younger individuals. The authors at this university explain that there are two sides to intelligence. One, fluid intelligence, the ability to solve novel problems, reason quickly, and adapt. This peaks in early adulthood and may decline gradually with age. And two, crystallized intelligence, which is accumulated knowledge, vocabulary, and wisdom, and life experience. This continues to grow through middle age and often into later life. What this means is that a younger adult may be quicker at solving a logic puzzle, but a 60-year-old offers a more nuanced solution as a result of deeper knowledge and emotional maturity. Neuroplasticity, the brain's ability to form new connections, actually continues throughout life. Brain Health University reports that older learners often make stronger long-term memories because they connect new information to deeper life context. They may learn a new language more slowly, but they retain vocabulary better by linking it to real-world experience or established concepts. In a recent book, Becca Levy, PhD, a professor of epidemiology at Yale School of Public Health, repudiated all the stereotypes associated with aging. In every case, she explained, I found information that not only contradicted the negative stereotypes, but also highlighted a strength that comes with aging. Levy pointed out a host of artists and musicians who defied conventional wisdom by becoming more creative and more generative later in life. Unfortunately, culturally ingrained stereotypes are very difficult to change. The AARP reports that among working adults, ages 45 to 74, 72% of women and 57% of men have experienced age discrimination in the workplace. Beth Castle, managing editor of In Her Sight, reports that of the 72,675 charges of workplace discrimination that the EEOC dealt with in 2019, 15,573 of them were linked to age. That number should be 0, she snaps. One of the problems with ageism is that it is seldom overt. and often difficult to substantiate. A snide remark may seem harmless, but it is stigmatizing. Ageism often manifests as a snub, a dismissal without cause, or the closing of doors that should always be open to talent and ability. It is my observation that the younger generations of today exhibit much more bias toward older generations than my generation did when we were the younger generation. I'm a social media junkie, and I love to frequent the dental social media groups on Facebook. One day, a younger dentist actually posed this question: why would a dentist over the age of retirement want to continue to practice dentistry? The comments in response to this question were quite disturbing. While some older dentists explained that they practice dentistry because they love the profession, others actually believed that dentistry was only a means to accumulate income and retirement accounts. Some viewed older dentists as a competition that should be retired at age 65 in order to increase the patient pool for younger dentists. The reality is that there is no competition. There are more than enough patients out there for all dentists. The real cause of ageism is narrow-minded thinking. Narrow-minded thinking is in vogue these days because critical thinking skills are no longer taught by the educational system. What do I mean by that? I have enormous clinical experience in full mouth reconstruction and crown and bridge dentistry. I was trained by a master, and I spent a lifetime studying and building skills and knowledge in this area of clinical practice. My father and I, between the two of us, have accumulated 70 years of documented evidence for the basic principles and techniques that were applied to all of the cases. I could show cases that I personally created that have lasted in health for over 40 years with x-rays. I don't know a single practitioner anywhere in the country who can match this level of documentation. Whereas my generation of dentists were eager for this kind of knowledge when I was young, today's generation of dentists are not even interested in acquiring sound crown and bridge techniques that have a real track record. Young practitioners, who often profess to have a greater clinical knowledge than I do, view me as old-fashioned, or, as I hate to say it, old. They have no interest whatsoever in my perspectives. I can't even give away my storehouse of clinical knowledge, and believe me, I would if I could. It seems to me that science no longer matters. Neither does evidence, and certainly not merit. All that matters today is economics and workflow. It pains me to see so many of my younger colleagues actually having difficulties with crown and bridge, with problems that were solved in the 1930s. It's no wonder why most younger practitioners would rather extract perfectly restorable teeth and place implants. This month's issue of Dentistry Today showcases an article where all the upper teeth on a patient were extracted to place an all-on-X implant-supported framework. The before x-rays clearly show that the patient had a great foundation for dentistry, long curved roots with sound periodontal bone. The prognosis for saving these patients' teeth with crown and bridge and no implants was excellent. I know that I could have easily saved this patient's teeth with crown and bridge work, since I have documented successful cases that were far worse than this one. But here's the real kicker. No one ever objects to this kind of travesty that patients are continually being subjected to. Is it ethical for a magazine to publish a case that should have been dismissed for poor case selection? I cannot stand to watch patients like the one in the magazine receive overly invasive treatments that actually have less prognosis for success simply because younger practitioners only know how to place and restore implants. Even the majority of implant cases don't adhere to sound basic principles of engineering. Implantology expert Dr. Carl Misch's research emphasizes the importance of designing implant cases around the management of biomechanical stress. Nevertheless, implant cases in articles and lectures are commonly overloaded with large superstructures they are clearly not designed to support from an engineering standpoint. Worse, the restorations are often designed in such a manner that they are impossible to clean. After 40 years of experience with implants, I started with implants in the 1980s when Dr. Brannemark first brought them to this country. I can safely say that implants are not panaceas, yet they're being applied by today's young practitioners as if they were. It doesn't take a rocket scientist to predict that implant failure rates are going to skyrocket. I believe that treatment planning should incorporate an armamentarium that includes both crown and bridge skills and implant skills so that the best treatment option can be applied for each individual patient. In addition to clinical expertise, critical thinking skills are required for treatment planning, along with a sense of ethics to do right by patients. A good ethical yardstick that dentists should always consider is this: what treatment would you choose for yourself if you were sitting in the patient chair? Lack of critical thinking ability and ageism go hand in hand. They are both symptoms of narrow mindset. The onceinaBlueMoon.ca website offers an appropriate list of symptoms associated with narrow-minded thinking. 1. Resistance to new ideas. 2. Difficulty with perspective taking. 3. Reliance on stereotypes and generalizations. 4. Discomfort with complexity. 5. Lack of intellectual curiosity. And 6. Defensive reactions to criticism. It should be clear to everyone that ageism has no place in a profession supposedly dedicated to lifelong learning. According to the United Nations, about 1 in 11, or 9% of people, are over the age of 65, and this figure is projected to increase to 1 in 6 people, or 16% by 2050. According to Manjula Klamath of IMM Press Magazine, which is the magazine of the University of Toronto's Department of Immunology, this shift demands more conversations about how the process of aging is viewed in our society. Manjula points out that in many Asian cultures, aging is synonymous with gaining wisdom. Older individuals are valued and treated with reverence and respect in these cultures. Not so in Western cultures. Older individuals are commonly cast off as worthless burdens of society rather than revered as productive contributors. The younger generation would do well to embrace the idea that aging is not decline, but transformative, an important part of the personal growth experience. The unspoken narrative of bias that is so deeply embedded in societal institutions must be obliterated in order to break the vicious cycle of perpetuating stereotypes. In a flash, today's younger generation will be the new older generation, and justice will be served on a silver platter.